those are kind of the fundamental basics along with height, weight, blood pressure, and waist circumference.
So something that I've been hearing about a lot lately, and I don't know the veracity of it. Even one of our speakers had brought it up on a panel last night. Is oxalates in green vegetables? Is that something that we should be concerned about? How do we, if so, how do we minimize that? Obviously, green vegetables have so many wonderful characteristics and are extremely helpful. So what's the what's
So I
the
see oxalate issues. Oxalate issues can look like joint pains, can look like systemic problems, but it can be secondary to the gut being inflamed as a microbiome level. I do oxalate testing on my organic acid tested. So I'm a functional medicine doctor. So I also do tests outside of LabCorp and Quest that look at something called organic acids and nutrients within the red blood cells. So that type of test shows me oxalate levels in people. And I see high oxalates when people have bad gut microbiome or have toxins in their system, like mold toxins. But I don't think it's a major problem for most people. I feel like it's a subset of people that have an oxalate issue. I really don't want to keep people from greens because they're so good for you. So just like nightshades, which can be problematic in certain individuals with arthritis, which are eggplant, peppers, tomatoes, potatoes, they can be very problematic along with sugar for arthritis. But I would never keep everyone away from that because a subset of people have a problem with that, you know. So I try different things for most people.
A major concern that you hear a lot of people complaining about nowadays, and I'm sure it was always a problem, but it seems to possibly have gotten worse, or people a little bit more conscious of it, is brain fog.
Mm-hmm.
What are a few items that that people can do that you would think would help them reduce their brain fog?
So one would be to work on their insulin. So we are seeing a lot of brain fog in long haul COVID, which is from a completely different issue, which is tons of inflammation in the body, and also lack of perfusion to the brain, because a lot of people with brain fog have blood vessel issues that change as they lay down to sit up. So perfusion for the blood doesn't go into the brain, and that can result in brain fog. Hormone changes can result in brain fog. Low iron can result in brain fog. So the first thing would be to check someone's insulin level, because when people's insulin level and sugar control are off, that will result in fogginess and difficulty concentrating. That's a simple one, good and looking at the gut microbiome. But in addition to that, I would say looking for inflammation within the body. So remember, gut brain is a big thing. I usually start with the gut, but working on your diet, adding more fiber, taking out inflammatory foods, making sure you're not iron deficient or B12 deficient or vitamin D deficient. Those are also important tools, as well as hormones. So when women go through menopause or men go through andropause, at least lower estrogen can cause brain fog, and lower testosterone in men can cause brain fog.
So during your presentation, you were talking about sugar, specifically in the context of glycemic index and its impact on insulin response. What is the role of fat with regard to insulin? Does insulin or does your body respond to fat with an insulin response at all, or is that neutral?
Think I'm not as clear that fat has a high signal on insulin as much as protein does. Protein can affect that pathway, but when people do things like keto, for example, keto diets are used in diabetic patients now to help control their insulin response. And that is a high fat diet. So I don't think they have detrimental effects as much as protein and carbs do on the insulin.
Thank you. All right, so I'm going to open up to our audience to ask a couple of questions. So, Sarah L., please state where you're from and ask your question.
Yes, hi there. I really appreciate this presentation. It's amazing.
Thank you.
So I'm from Maine, and my question is that for about the past few years, I've had this fairly chronic burning sensation in my stomach, and tests have shown that I've got inflammation on my small bowel. Um, and I haven't eaten processed food for years. I eat a very, very healthy diet, and I'm not able to gain weight. My weight is really low, and I have osteoporosis.
Yeah.
My doctor thought it might have been something acid related, but Prilosec didn't help. My bowels are absolutely fine, so I'm underweight, and I have this burning and I have inflammation in my small bowel.
So the context of the inflammation in the small bowel, my issue would be to make sure you don't have any markers of inflammation that are suggestive of inflammatory bowel disease like calprotectin or lactoferrin in your stool, because that is small intestine is where you absorb a lot of nutrients. It's a very large area, but there are aspects of it, if it's inflamed, you will not absorb nutrients. So the level of severity of inflammation within your small bowel needs to be quantified. And if it is just something like small bowel overgrowth, that can be treated with antibiotics. But there are things that are beyond that in terms of mucosal disruption within the small intestine that can limit your ability to absorb. So I think I would work with someone who's more in tune to those kind of concepts to see where you're falling in that whole spectrum.
Okay, so just to understand, what you're telling me to do is get the specific amount of inflammation more documented, like quantified. And what test would that
Stool tests,
require?
and there's MREs, there's MRIs that look at inflammation within the small intestine.
Okay, thank you so much, doctor.
Okay, our next question is coming from Patrick M. Patrick M, please unmute yourself, state where you're from, and ask your question.
Thanks, Michael. New York. Thanks, Doctor. An excellent presentation. You mentioned in relation to the extended fasting, so the multi-day fasting, that there was a substantial benefit to the immune system. Could you give us a little more detail on that?
You mean the 5-day fast that I was talking
It
about?
was a 5 or 3, whatever you
Yeah.
mentioned.
So the fasting mimicking diet mimics a 5-day water fast, which has been shown to reset stem cells, which are these amazingly nubile, like very new cells within our body that can be whatever they want when they grow up. So they're untainted, they're not pre-diabetic, they're not autoimmune, they're not full of virus or anything. They're just very, very efficiently young cells that come out. And that comes out between day 3 and 4 of doing a water fast. And so that's a really great way to reset that immune system. Remember, I talked about how all the dysfunction of the immune system can happen. You can have autoimmune, you can have low activity to viruses and cancers, and you can have allergy type responses. And when you start to affect with stem cells and regeneration of the immune system, you start to kill off those negative cells and you start to build a whole new panel. And so repetitive use of this kind of concept with 5-day water fast is a very nice intervention for immune dysfunction. And that's on their website. So I can't talk as much about it right now, but if you go to Prolon or L Nutra as a company, they have a lot of information on it. Prolon mimics a fasting mimicking diet because it is very challenging to do 5 days of water fast for most people. But many people can do 1,100 calories on day 1 and 800 on the other days. I do it 3-4 times a year. And 1 or 2 of those times is with my patients. We do it as a Facebook group. And so it is a very effective way to see immune changes. And I've seen patients get better with some of their joint pains and some of their asthma and some of their immune dysregulated stuff. Is it a home run for everyone? No, but it's part of my toolkit to help people.
And is there something magic about the 5? I hear some discussion about 3 days. Is there?
I don't think the 3 days induces stem cells. I think you have to be fasting for 4. 3 days does do lots. So even a 12-hour fast rests the gut, helps the insulin, changes the gut microbiome. In 3 days, you can start to increase resilience genes. Every hours of fasting has a benefit. It's just in terms of the immune modulation, I think you have to get to day 4.
I see. Okay, thank you, Doctor.
So we just have a couple of minutes, and you talk about gut health was obviously a major part of the presentation, and antibiotics is obviously a medication that's commonly administered. And I've heard, of someone, for example, taking antibiotics for one thing and then afterwards getting shingles, then getting gout. How does taking antibiotics affect our overall health and make us susceptible to various illnesses? And is it possible that something like shingles after antibiotics or gout could be a thing, or is it unrelated?
So one, I want to just throw out there that antibiotics are very useful and people need them when they need them, right? So all meds have a role, but we have an overuse concept in America, right? We use them all the time, specifically in kids. So it keeps changing our gut microbiome, not in a favorable way, over 6 months. So one round of antibiotics can change for 6 months. And a round of probiotics can help, but it's not the end all be all. So it is absolutely can, when you get bad bugs, and if it could change our gut microbiome, when you don't have a resilient kind of a group of bacteria, you can create a dysfunctional state of gut flora that can then induce something called leaky gut or intestinal permeability. And that is a whole big ball game of anything's possible. You can actually induce changes that can lower your immune system, which leads you susceptible to shingles. You can activate it, which leads you susceptible to autoimmune. So I don't think it's hype. I just feel like it's not, don't be scared of one round of antibiotics for most people. But if there is a way not to use it for a sinus infection or something else that might be viral or allergic, then I would say, let's try not to use it. But when we need it, we need it. Like, antibiotics save lives. So I'm not going to say don't take antibiotics. But yes, the immune dysregulation from it is real. And I think it can start to affect different aspects of immune dysfunction in different capacities based on what that person started with. If I started with it and I took 2 rounds of antibiotics, maybe nothing happens. But if somebody else has only this much diversity and they take 8 rounds of antibiotics, anything's possible, because it's just about the change that happens and how many bad guys overpower the good guys.
Great. Thank you so much, Dr. Rao. It was a very informative presentation. So I'd like to thank you. And if we can, so your book, Body on Fire, obviously is available on Amazon and other book outlets. If you go through our bookstore, you can purchase it there, and The Real Truth About Health will get a little bit of funding to support our effort here to get this information out. If we can unmute the audience so they can share their appreciation.
Thank you so much,
you.
Dr. Rao.
Thank you.
Thank you so much.
You're the best.
Thanks, doctor.
Thank you.
Oh my goodness.